Thank you for staying with us. Joining me now from the Brockville Hospital Foundation, I'm talking with the executive director, who happens to be Trish Buote, and she's going to be telling us about Med Talks. Hi, Trish.
Hi, Doreen. How are you?
Very well. Can you tell us when the next Med Talks will take place?
The next Med Talks is next Wednesday, so September the 24th. And it's going to be held at the Aquarium, which is where we've been holding all of our Med Talks. And we're pretty excited about it. Our Med Talks is a kind of an informational series in partnership with Brockville General Hospital and bringing, medical professionals to talk to the community and matters that the community wants to hear about. So I'm so thrilled to welcome Dr. Gerald Evans for next Wednesday, again at the Aquarium. And Dr. Evans is the immediate past chair of the Division of Infectious Diseases and the professor in the Departments of Medicine, Biomedical and Molecular Sciences and Pathology, and Molecular Medicine at Queen's University, and an attending physician in infectious diseases at Kingston Health Sciences Center, where he has been medical director of infection prevention and control since 2011. Wow.
So, yeah, I know. I guess it is wow. But
we're so thrilled.
You should be. I mean, this is awesome because people will have the opportunity to talk with Dr. Evans and ask him questions and get some good, solid answers, right?
Absolutely.
Okay, so Trish, do you mind if I take over here and talk with Dr.
Perfect.
Evans? Okay, I appreciate that. Dr. Evans, welcome to FYI. So we know that the fall and the winter, it's going to happen. We know it's coming. So what is the biggest respiratory health concerns that people will experience?
Yeah, I think right now at the moment, the things that I'm going to predict, and I always get a kick out of when people ask me this question because I'm really a doctor, not a clairvoyant. But having said that, I do know a little bit about these infections, particularly about influenza and COVID-19. So I will say this: we are beginning to see a resurgence of COVID-19 after it being very, very quiet for almost 6 to 7 months. The level of activity here in southeastern Ontario has been remarkably low all through since about March of this year. So that's coming now, and that's probably going to be the early surge we see a bit in the fall. And then the other one that, of course, we always worry about is influenza. And influenza right now may be on target for a bit of an earlier season. Typically, we worry about influenza from October to March. But here in southeastern Ontario, over the many decades I've been an ID doctor, it typically hits, in January, but this year it might be a little bit early. And that's important because when influenza goes up, COVID-19 goes down. So this is a viral interference signal that I'm going to talk about next week when I'm doing the Med Talk. So that's what we're looking at the moment. All the other viruses that are out there, of course, they circulate seasonally. I'm going to talk a little bit about seasonality next week when I'm chatting. And right now, the other one that's coming up, which always comes up in the fall, is rhinovirus, which is the cause of the common cold. And kids are back in school, students are back in various levels of education, including universities and colleges. And when that happens, rhinoviruses always go up. Fortunately, for the vast majority of people, rhinoviruses are just a common cold and don't typically cause lots of other problems. But we worry about them still because some people who are very vulnerable may end up with nasty infections.
What are the groups that are very vulnerable?
Yeah, I mean, typically the very young and the very old.
Okay.
Those and that applies across most of the spectrum of the respiratory diseases that we see.
Yes.
And in the case of influenza, of course, we've got a vaccine. So, get your vaccine, get your flu shot, and you'll probably avoid getting super sick with flu. You might even not get the flu with your flu shot, although that kind of protection is less so. But those are the main groups. But the other people are people who have chronic medical conditions, problems with their heart, their lungs, and of course, patients who suffer from cancers and other diseases where they might get treatments that suppress their immune system somewhat.
So with taking the vaccine, it will help people if their systems are compromised, yes?
Yes, absolutely. And, we've got lots of great evidence now, especially in older people who we now have a high dose flu vaccine that is very protective. And that will really, if they do get the flu or if they get COVID and they've had their COVID vaccine within the last 3 or 4 months, then the likelihood that that'll be a severe episode is much reduced, and therefore less likely they're going to be hospitalized, less likely to have a very bad outcome, such as death, which can occur with these viruses because they can be quite deadly to some people.
Other than taking vaccines, what are some of the other things, some of the common everyday things that we should be doing that we take for granted and don't do?
Yeah. So one of the things is very old-fashioned, and I can't emphasize it enough, particularly with rhinoviruses, which are principally transmitted on people's hands. They're what we call fomite transmission. So somebody with a cold who, touches a doorknob after they've just, sneezed or something like that.
Yes.
Then if you come along and you handle that doorknob and then you go scratch your eye, that's how you get a rhinovirus. So washing your hands, incredibly important. It was a bit de-emphasized during the pandemic because there was so much attention being paid to the idea that short-range aerosols could result in transmission of COVID. But washing your hands will prevent most of the respiratory viruses that are out there. The other thing, of course, which is a bit new to people here in North America, but not so much in other countries, is wearing a mask. And a mask can be useful in preventing transmission by droplets or short-range aerosols, particularly if you're indoors with a lot of other people around where there's a lot of crowding and not a lot of air circulation or so. So those are probably the two main things that one can do if you are trying to avoid respiratory infections. And then the last thing I always like to say to people, if you're sick, don't go to work and don't go to school because that's where you're going to transmit it to other people. And you don't want other people transmitting it to you because they've gone to work and they're sick. And that's a really kind of important cultural element because there's a bit of a, I would say most people, most adults in particular are like, oh, it's just a cold. And they know it's just a rhinovirus cold. But they go to work because it's like, well, I'm so important. I have to be there for things. And sometimes you are, by the way, important.
Yes.
But not always. You have to use what I call the bucket of water test. And that is if you put your arm in a bucket of water and you pull it out and the water doesn't rush in to replace where your arm is, then you are clearly irreplaceable. But otherwise, you're not.
You're absolutely right. But yes, we think that we're indispensable and that, we have to go to work. But it's just what you had said earlier about the students that are going back to schools, universities, colleges, etc. They're coming together as a group, and it's very easy to start the spread of a virus.
Absolutely. Absolutely.
Really
Yeah.
is.
And the rise in rhinoviruses that we see in September and October every year, and that's been going on since time immemorial, is all due to the bringing back together small children, young children, and even adolescents and youth. They're the ones that tend to get these. They don't have a big consequence from them, but they're able to spread them because the nature of our interactions when we're younger is not to necessarily wash our hands or be careful of around other people who are sick. So yeah, it's easily transmitted.
I'd like to talk a little bit more about COVID. So you're saying we're on the rise. So there is a vaccine that is available now, or will there be another one that's going to be coming out?
So the two COVID vaccines for the current variant, which is circulating, which is called LP.8.1, have been approved by Health Canada. And one of the manufacturers, Moderna, actually has a factory in Canada now that produces the vaccine. So we don't have to rely on the Americans shipping it up to us. As to when it's going to be available for people to go to their pharmacy or their physician or public health to get that vaccine, that's a little bit in flux. We're told sort of early October. Okay. And again, that's the same time that the flu vaccine gets shipped out to pharmacists and doctors to give to people. But, that date can sometimes get a little messed up depending on all kinds of other vagaries that occur in this sort of shipping and purchasing of vaccine and stuff. So I'm hoping that that'll be the case, certainly for COVID, because as I said, it looks like it's on the rise a little bit earlier. And, we haven't seen much of an influenza signal, and it would be a little bit early to see an influenza signal at the moment, but that's coming later on. So, so if everybody who's over 65, absolutely. I think most adults should get it, especially if you haven't had one for the last year or two. So when that's available, they should reach out and get it as soon as they can.
In the past, when I've had the COVID shot, I was able to go ahead and have the influenza vaccine applied at the same time. Will that not be an issue this time around if they happen to coincide at the same time in the pharmacies?
Definitely not an issue. In fact, administering both vaccines at the same time, believe it or not, seems to actually improve somewhat the what we call immunogenicity of the flu vaccine. So yes, if you're going and you can get your COVID shot in one arm and your flu shot in the other arm, absolutely go for it. There's no contraindication. There's no increase in side effects from having both vaccines at the same time.
Dr. Evans, do you have one last major piece of advice for our Eastern Ontario viewers?
Oh, about respiratory virus?
About anything to do with
Oh my gosh. Yeah. One of the things I would just emphasize that, in addition to wearing a mask, which is entirely reasonable, and there's lots of good reasons why people wear masks.
Yes.
So, don't be mean to somebody who's wearing a mask, and don't be mean to somebody who's not wearing a mask, because, it's not that it's an absolute. So I think it's that interaction. We're seeing a lot of polarization nowadays. And when we see people wearing masks, sometimes there's a bit of a gut reaction to why are you wearing it or why aren't you wearing it? So please be kind to people. People can make their own personal decisions about this. And I think it's entirely reasonable. You don't know enough about someone who might be in a store who might be wearing a mask because you don't know their own personal history. And then again, I would just emphasize, yes, wear a mask, but wash your hands, folks. Like, it's really kind of simple stuff, except if you're a toddler. Toddlers don't wash their hands very well, but we adults, we're supposed to be pretty good at doing that sort of stuff. So get your chance. And lots of places have alcohol hand rinse dispensing where you can just squirt some on your hands and rub it. Yes. Perfect. Great thing.
Thank you ever so much for taking the time out of your busy day to Zoom with us and talk to us about Med Talks. And what time on is your Med Talks, Trish? What time should people arrive at the Aquatarium?
Wednesday, the 24th, so next Wednesday at 6 p.m. is when we start.
6. Okay.
So you can come anytime between 5:30 and 6, and there's seating up 400.
Okay.
And we just ask them, you can call the office at 613-345-4378 and speak to Emily or anybody who picks up the phone, and you can register that way. Or go to our website, bdhfoundation.com. Go to our Med Talks, and you can register there. It's an Eventbrite. We need to know that how many seats that we're selling. It's a free event.
Right.
As you can see, Dr. Evans has a lot to share. And,
he does, yes.
He'll ask for your questions. Your questions can be unique. He's not your doctor, so he can't diagnose you, but he can certainly tell you his perspective on things. So we're really, we're very fortunate to have Dr. Evans come to speak to our community. So please join us.
Thank you, Trish, and thank you, Dr. Evans, and
thank you.
wish you all the best. Thank you.